want you to understand some key aspects regarding disinfectants. One is, what are the types of chemical disinfectants? Let's have a quick run through of this. The first one is alcohols, that is ethyl alcohol and isopropyl alcohol. You've got aldehydes, that is formaldehyde, glutaraldehyde and orthophthaldehyde. You've got phenolics, that is cresol, lysol, chlorhexidine and chlorxylenol. Halogens we already mentioned, iodine and chlorine. Oxidizing agents, that is hydrogen peroxide and peracetic acid. Mercuric salts and copper salts can be used. Surface active agents, which are very popular now, which are the quaternary ammonium compounds in soaps. You've got dyes, which are aniline and acridine dyes. And even though we are mentioning about disinfectants, there are certain chemical agents which can act as sterilants when they are used at higher temperatures. So gas sterilization is possible using certain chemicals like ethylene oxide, plasma, ozone and low temperature steam formaldehyde. So there are certain chemicals which can act as sterilants when they are used in sufficiently high temperatures. Okay. So I've given you a broad outline as to what are the different types of disinfectants. So there's a long list, but you should remember alcohols, aldehydes, halogens, oxidizing agents, surface active agents, and the gas sterilization options. Okay. So then let me ask you a question. How do we decide what is the best method of disinfection or sterilization for a particular equipment? The answer to that lies in the Spalding classification. What is the Spalding classification? Based upon the use of a particular item, whether it comes in contact with intact skin or non-intact skin or with a sterile body surface, based upon that, you will decide whether to disinfect or sterilize. So, Spalding has classified items into critical items, semi-critical items and non-critical items. So, the name itself explains it. What is a critical item? A device that comes in contact with a sterile body tissue or bloodstream. So, imagine something that's like maybe say a surgical instrument. It is coming in contact with a bloodstream or with a sterile body tissue. So, that means it is a critical item. Critical items should always be sterilized. Option 1. Remember this point. What is a semi-critical item? A device coming in contact with non-intact skin or mucous membrane. Example is a scope. Okay, an endoscope. It is coming in contact with the mucous membrane. So that requires high-level disinfection. You can sterilize it, but high-level disinfection is still good enough. Whereas what is a non-critical item? Something that comes in contact with your intact skin. Think of a BP cuff or a bedpan. So that, depending upon the item, can be either having a low-level disinfection or an intermediate level disinfection. See, I hope that from this Spalding classification, this part is really clear. Critical items come in contact with sterile body tissues or bloodstream. They should be sterilized, and that is why they are called critical. Semi-critical item comes in contact with non-intact skin or mucous membrane. High-level disinfection is enough. And non-critical items can have low-level or intermediate-level disinfection, and they come in contact with the intact skin. So here are some examples of critical, semi-critical and non-critical items. Critical items are your surgical instruments, the biopsy forceps, catheters, needles and so on, right? And the semi-critical items, we already said, the scopes, respiratory therapy equipment, anesthesia equipment, and low level is your BP cuff, the bedpans, the urinals, the pulse oximeters, and all those things come under the low level disinfectants. So, besides this, there's another thing which I want you to know, which is which are the high level disinfectants, which are the intermediate level, and which are the low level disinfectants. So the high level disinfectants, this we already mentioned, is the ETO, the peracetic acid, okay, they are sterilants, but they can act as disinfectants. You've got aldehydes like glutaraldehyde and orthophthaldehyde, hydrogen peroxide. Sodium hypochlorite or chlorine, all these are high-level disinfectants. So ethylene oxide, peracetic acid, hydrogen peroxide, which is a gas plasma,